Hey, so I went to see Dr. Virojanapa again. Of course, today he's like, I don't see any reason to do any surgery on you. And it's like, okay, well, like, why not? And so that's not how the conversation went exactly, but I'm just saying, like, he, he said because the MRIs didn't show the problem, like, insurance isn't gonna give a go ahead on it. And like so that's like the thing, like, and he's like, and he doesn't even believe that I have damaged connective tissue. um be, and it's strange because it's like it's confirmed on digital mission x-ray. I have all the symptoms. This is after I tore the area around my C1, and I became a bobblehead and had all these neurological symptoms. And on top of that, doing regenerative therapy on those ligaments helped the problem, which further confirms that that is the goddamn problem. Because when tissue tears, you're talking about muscle, you're talking about connective tissue. And if the muscle tore, I'd have felt it in the muscle. I didn't feel it in the muscle, I felt it inside my C1. What's inside my C1? Alar. And what's running along the backside of the C1? Posterior longitudinal. So it's like, and that's where I felt tearing right back up in there. And when I feel unstable, when I'm moving around and I feel my head shift around, um, I feel pulling and stuff, and it's not the muscles that are getting pulled. Um, and so, I mean, it's just a metric shit ton of evidence showing that I have CCI, and he's saying because he can't see it on MRI, which is like saying, like, taking a picture of the sun with like a 1990s camera, or the moon with a 1990s camera, I guess, and like a digital camera, like cell phone, 1990s cell phone camera, and then being like, I can't see it, it's not there. There's no moon. I took a picture of it, it's not there. It's like, that's the logic we're using here to troubleshoot. So, you know, but regardless, even if he did believe it, like, I see why all these other popular surgeons for craniocervical instability don't take insurance, because insurance won't pay for it unless it's so fucked up that it shows up on the MRI. The problem with that is the only thing that can really fuck up a ligament that bad to where it's like, not like stretched and loose, but like torn, like shredded in half, is like severe trauma. And typically with that, like, you're also dealing with like broken vertebrae and stuff like that. So if it's that fucked up, then you can see it on an MRI. But if you have someone with CCI, you can't see it on an MRI. Sometimes with flexion extension, you can. I mean, the flexion extension I did for him was prone, so I was laying down. I was like laying down like this in an MRI, and then like hold your head like this. So if I do that, I'm fine. It's when I get up and I lean forward, just that right there, I can feel it in the back of my head. It's real fucked up. But they don't have upright MRIs or anywhere around me, so it's like, what the fuck? So we're doing imaging that's not of where the problem is. That'd be like taking imaging of a car that has a wheel that's like wobbling, right? And taking a picture of it and being like, hey, see, it's not wobbling. It's like, yeah, moron, you gotta, it's when the car's moving, not when it's parked. Like, it's like, oh, oh my God. Oh, like, it's special, man. Like, Jesus Christ. Um, I have an issue moving. I don't have an issue not moving, which means you're gonna need take some imaging of the positions I'm in. That doesn't mean like if a car's tire was wobbling, you could take a series of pictures, and as the car moves along, be like, okay, here it's lined up, here it's not, and it should be straight. You could do that. So you don't necessarily have to be like a video. And same with your body. Like, that's why they have like flexion extension X-rays, flexion extension MRI. But it's like, if you have CCI, you got to get up, right? thing is, a lot of operates are 1.5T and you can't see the ligaments at all. So basically, you're looking at, does the head move significantly enough so it's unstable? I feel unstable in my C1, and if I push it, my neurological symptoms, I'm going to tear it again because it's so weak. Like, I can feel how weak it is. And the thing is, unless I tear it, you're not going to see it. So it's like, what do you want me to do? Do I gotta tear my neck to get surgery? It's like, and then even then, like, would my vertebrae in my head be moving in such a way that they'd be like, oh man, there's a problem here. It's like, and but like, then like people will be like me and then go to see Dr. Henderson or that dude in Spain or whatever his name is, and get surgery and then they're fine and they're just living their life. And Dr. virojanapa is like, man, if we do this surgery on you, man, like, you're gonna lose range of motion. And I'm like, I don't think he knows what it means to be to suffer. I don't think he has a clue. I don't think he suffered in his life. I mean, um, from like a illness. I mean, like, I don't think he understands. Like, because he's talking about, oh, you're gonna lose some range of motion. You know what my range of motion is now? About 45 degrees. He's like, oh, you're gonna lose half your range of motion. I already have, you know. And I'm stuck in this chair or I'm stuck in bed, 22, 23 hours a day. I just I mean, I don't know how, like, you go to school and, like, I mean, it's to the point where I'm wondering, like, how he gets outside the house with his shoes tied. I'm like, like, do you go up to someone on fire and be like, yeah, I can put you out, but then you'll be all wet, man. Do you want to be wet? Like, God, like, that's the fucking logic we're using here. It's like, what the fuck? It fucking blows my mind. I'm like, I have screaming tinnitus, just blank stare. I'm like, it's like a crying baby next to my fucking ears 24/7. Blank stare. Uh, Dizziness, weakness in my neck, bobblehead, blank stare. Like, no fucking idea what I'm talking about. Like, it's just like, it doesn't mean anything. And he's just like, yeah, but that range of motion though. I'm like, and I kind of get a feel for, like, because I've been living with this for 3 years, of people that, like, when they comprehend what I'm talking about. Because, like, you talk to people who have CCI, I talk to the people with CCI, I talk to them, and they talk a certain way when they understand what you're talking about. And then the people that don't have a fucking idea what you're talking about, they talk a certain way. And when your doctor talks like the people that don't have a fucking idea, that's really bad. So a lot of people talk Dr. virojanapa up, and I'm just kind of like, not impressed. Like, not even a little bit. Um, because the logic was so flawed. It was like I'm embarrassed for him. Like, if he was like, look, um, it's not something I want to rush into, but, like, if that's something you want to try and you're like, life is such poor quality and such shit, and every time you do anything, you're having pain up around C1, you're bobbling your head around, you can't do anything because that's in that area is giving you trouble all the time. Like, we could try doing that, but there's also the thing of, like, I have to explain it to the insurance company, and, like, for them to, like, before, because they have to approve the procedure before. You can't just do it and be like, all right, now we're going to bill insurance. Like, insurance has to give you the go ahead on the code beforehand. Uh, Whatever they're called, something codes, I forget. But I could understand if he was like, it's we could do this to try it because your life's quality of life's so poor. Like, every day you want to die and you pray for death and you hope for death and you want to be euthanized and your life's not worth living and it's hell on earth, and I get it, but, like, we want to do something to help, and but I can't find it on the MRI. And so, like, if you could go to someone like Dr. Rosa and get that more advanced MRI like imaging, then we could have something to say to insurance like, look, here it is, and then we could do this, we could try this thing. That then I could respect that because it's like, okay, it's logical, but it's like those shit he's saying, it's like that doesn't even fucking make any sense, like not at all. Um, and then on top of that, I'm talking about Dr. Rosa. I'm like, yeah, so like Dr. Rosa has like imaging that like can actually show severe cervical ligament damage that typical MRI won't find. This is a blank stare. It's like, write it down, Dr. Rosa. Like, he can teach you how to do an MRI for CCI. Like, write it down. It's just like, hello. And Dr. Rosa does teach neurosurgeons. He's like, look, this is how, like, what's going on. This is what I'm doing. Um, you should have your patients do this, and here's why. And like, I don't know if he's showing them all the ins and outs of the MRIs, but like, I've talked with Dr. Rose's office, and they told me he was busy talking with neurosurgeons, like doctors trying to tell them like, here's this ligament damage, and we can clearly see it. Um, and you know, thing about the out of pocket stuff though is like, I don't know if I need to see Dr. Rosa because like, I don't know if Dr. Henderson would be like. I think with Dr. Henderson, he's like, give me $1,000 up front just to talk to me. Just kind of douchebag move. Um, so I'm calling you out, Dr. Henderson. Come on, like literally every insurance out there would cover an evaluation for neurosurgery through insurance. Like, I'm pretty sure. I don't believe for a second this $1,000 thing you do where you're like, no, you gotta pay up front for that. I think that's just like, come on, like you could do that. You could do that. The surgery itself, if you're like, I want to do this surgery, I want to do it my way, I want to do it on my conditions. Customer has to pay up, patient has to pay up. Fine, fine. Um, but the upfront $1,000. So anyway, that doesn't make any sense to me. So anyway, but I don't know if he would want me to take, because like if he looks at my MRI, if anyone looks at my MRIs, they're not gonna see anything. And I look at them, I don't see anything. People are like, "What do you know?" I'm like, I know what I'm looking at when I look at an MRI. I like, you can see the ligaments, and you can see the muscle, and you can see the spinal cord, and you can see the vertebrae, right, and the tendons. I can see all that, and you can see like the where the veins and arteries are. And but the thing is with the ligaments on the spine, they're notoriously hard to see. Like, you're scrolling up like 3 millimeters on a layer, like you're getting like little tidbits of a ligament, depending on like how the MRI is taken, and it's not enough, and then even then, like if you got a bit and you're like, I think that kind of looks damaged there, like damaged enough to cause CCI, and is it that ligament's that responsible? Because you're probably not seeing all the ligaments clearly. Probably not seeing like maybe you see a posterior longitudinal, but you don't see alar, or vice versa. And maybe one's really bad and the other one's not. So it's hard to see them. And so I think now I've had like, I mean, Dr. Bolognese looked at them, Dr. virojanapa looked at my MRIs. Nobody's gonna see anything on my MRIs. And consistently, the digital motion X-rays can show I have upper cervical ligament damage, and consistently regenerative therapy helps some. And if I had infinite money, I'd just be like, whatever, fuck you guys, you're all a bunch of dumb shits, and I'm gonna go get regenerative therapy. And but it's not the case. So it's like I got to deal with these guys being like, like Dr. Rosa doesn't want to show people how to do MRIs. Dr. Virojanapa doesn't want to talk to Dr. Like, how hard would it be for Dr. Virojanapa to call Dr. Rosa? Pick up your cell phone, look him up in Google Maps, press call, talk to him, just be like, hey man, I got a patients I want to see, like what you can see, on typical, and then compared to, like, I want to really talk to you about this and learn about this. And he's not gonna do it, because Dr. Rosa is a chiropractor, and what do they know? And Dr. Rosa is like, how do I get these freaking neurosurgeons to understand that the MRIs are ordering are bullshit? Like, and Dr. Virajanov is not going to call Dr. Centeno and talk to him and be like, so what's up? Like, why, all these people with CCI, I don't see anything on MRI, but when you do a PICL on them, it fixes them. If you're doing a PICL on them, it fixes them, then that's the fucking problem. It's because they have alar ligament damage. It's because they have CCI, and I can't see crap, and I'm turning these patients away and sentence them to a life of pain and suffering. What am I going to call Dr. Centeno and have him explain it to me? Nope. Not going to do it. Like, it's just like, and if I say, Dr. Centeno, can you call these neurosurgeons? He's not going to do that. Dr. Centeno, can you call Dr. Rosa and have him explain to you how to do a better MRI? Nope. Not going to do it. And it's a lot of ego in there. It's like, these guys are like, I am actual God. Everyone else is beneath me. Yeah. And, yeah. You're all full of shit. I mean, that's their point of view. They think everyone else is like full of shit. They're like, what I know is like, if I was a doctor, I'd be like, man, I know what I was taught in school and I know what I learned on the job, but I don't know shit. I do the best I can with what I got. That's what I would think. And I know that because I deal with very complex problems, or I did deal with very complex problems in network engineering and voice and cybersecurity and shit like that. And I mean, none of these doctors would be able to do what I did. Like, none of them. They wouldn't be able to hold a candle to me at that job. And I'm looking at myself being like, man, I don't fucking know. Like, there's just too much to know. And if I was a doctor, so I know myself, and I know if I was a doctor dealing with all this complicated shit, I'd be like, man, I don't know. I'd be like, I'm not special. I went to school, I did this work, but a lot of it doesn't apply anymore. And a lot of the new shit I don't know. And I'm doing the best I can. And I would always try to do a good job, and I would really work hard to do a good job, and I think I would do a good job. But it's like, I just would be like when I'm on a job in cybersecurity and I don't know something, you know what I do? Like, oh hey, I'm gonna call up Cisco and be like, hey Cisco, I'm having a problem with my firewall and I don't know what's going on with it. What do I do? And a lot of even people in my field, they won't do it because it's the ego thing. They can't do it. They can't call the manufacturer and be like, how do I do my job? Because I don't know what the hell I'm doing. Or in cybersecurity to call, someone who is an expert in cybersecurity. Like I worked at AEP cybersecurity. I can call someone who's an expert in cybersecurity and just ask them and just be like, yeah, I don't know what to do. Like, we're having this problem at my company. Nobody here knows what to do. What do we do? And you know who else is going to do that at my company? Nobody. AEP's got tens of thousands of people that work there. Not a goddamn one's going to do that. And I think it's just ego. I think it's just like you can't ask for help, especially if you're a man. Although I've never seen a woman do it either. But then again, not a lot of women work in IT. Maybe they should. Because goddamn the ego problems. But yeah, like, are there any women neurosurgeons? I need to see one. So, so, uh, sorry, it's extremely stressful for me to talk about this. Shit. I'm really tired and I'm really stressed. So, yeah. Neurosurgeons are shit in the bed. They're not going to stop shit in the bed. So, if you get MRIs and you send them to doctors and they're like, I don't see anything, then don't waste your time. seeing a bunch of neurosurgeons like I have. Um, just go to Dr. Rose and get the MRIs. And I guess I haven't done that yet, so I'm not 100% sure. If, like, say I go to Dr. Rose and I get the MRIs and I see the problem. I even asked him, I said, what if I go to Dr. Rose and get these MRIs? And it's like, okay, he's clearly got this problem. He seemed like maybe he might help me with that. But I don't think so. Because again, the ego, he already decided one way, so he can't be wrong. Because that means he's not a god. So he's not going to change his mind. So I'd have to go to another neurosurgeon. So I think if I want to go in the neurosurgery route, I have to go see Dr. Rosa, because nobody's going to believe I have any upper cervical problems until I see him. And the thing about him is, just doing a flexion extension for 2 minutes at normal killed me, man. It hurts. It still is burning. My neck is burning. I did it last Wednesday. And my next fucking next Thursday. Last Thursday I did it. And my neck's fucking killing me. And it's just burning like all around here, and it's not so bad on my C1 area. It's just I don't know. I mean, Dr. Rosa is very, because you got to stay there, because the slices are really thin. He's doing a lot of them, so a slice takes a certain amount of time. You have more slices, that's more time. That's how they explained it to me anyway. So if I do that, I feel like I'm gonna get injured if I do that. Like I'm gonna fuck up my neck bad. Either that or I'm not gonna be able to complete it. But if I do neurosurgery, it's gonna have to be that, because these neurosurgeons, like, they think MRIs are good, and they're not. MRIs are shit. I mean, just look at one. Like, just look at an MRI. Like, what the fuck? It's pixelated bullshit. Like take a picture with your cell phone and then look at an MRI. It's like, there's a difference in quality. And I'm not saying MRIs are like should be abandoned and like they're useless. I'm just saying, like, it's internal imaging of a human body in its infancy. You know, like 20 years from now, you're going to be able to see like crystal clear shit. You're going to be able to see like individual cells from outside. You can inside the body from outside. So like what we have now is crap compared to that. So, you know, it's no, and I'm not 100% sure it's going to be that level of detail and in that many years. Could be in 10 years. It could be in 30. I don't know. It depends on AI. It depends on what technological advances are. I mean, they have like 9T MRIs now, and like most places you go to, you're doing like a 1.5 or maybe a 3, and but nines exist, and it's like, so it's sort of like megapixels in a camera. So they're used in like research and shit, but they're, you know, million dollars piece of equipment. And insurance is like, oh, you don't need that. You don't need a 9T MRI. See the problem? 3T is fine. 3T means we don't have to do shit. Because we can't see it. So the insurance agencies are like, fuck a 9T MRI. They push back on everything, man. They are, you know, I don't think we should have private insurance in this country, because I mean it should be an option, but I think you need national, like everyone should just be on Medicaid. Like we should just all be on it. It should just be something everyone has. And then if you want, like, if I'm like, all right, I'm on Medicaid and I want my private insurance on top of that, and I'll pay like $250 a month or whatever, because then I can go see the doctors I want to see when I want to see them, and get more custom treatment stuff. But like the government will look at us and say, you know what, we would rather pay for these 90 MRIs because in the long run, 5 years down the line, we're saving, a lot of money. 10 years down the line, we're saving a lot of money. Whereas, like, the insurance agencies are just like, I just want to have these quarterly profits. They just got to go up. Or not, or yearly, whatever they do it. Some places just care about, like, stock price, by year. Some are like, shorter periods of time. But they want it to go up. And they need it to go up. And people's like promotions, like, I mean, even in fucking cybersecurity, for a utility, my bonus was based off of stock price. It's like, the fuck do I have to do with stock? I could literally not do my job and everything could get fucked and the stock wouldn't do anything. I mean it's possible. It's possible that like Russia could get in and like, do a bunch of hacking and shit and like shut down the grid. And I mean, if it got that bad, but like whether or not I did my, but what I'm saying is like individuals in insurance agencies are just like, look, my performance is tied to the stock price, or whether or not I have a job is tied to the stock price, whether or not I get promoted is tied to the stock. So I have to keep my job, so I got to do the shit that increases our shit like short term. So all the employees are just like, I'm just caring about short term. I don't care about long term, and we're all suffering because of it. And it's like they're people. It's just a group of people that like individually are just like, I just am trying to survive at my job, and they're just like, and the shareholders are just like, come on, man, get that stock up. Like, I don't know. Maybe we just got to make it so like nobody can buy stock in insurance. But anyway, that's my fucked up shit with Dr. V. Thanks, Dr. V. You're the best.